Welcome to our Agitation Management in Nursing Homes module. Imagine waking up in an unfamiliar place surrounded by strangers and struggling to communicate your needs. This is the reality for many nursing home residents, and it often leads to feelings of frustration and agitation. In this presentation, we will delve into the underlying causes of agitation, its impact on residents and caregivers, learn effective strategies to manage and reduce these behaviors, and identify methods of measuring its impact on care quality. By understanding and addressing agitation, we can improve the quality of life for our residents and create a more supportive and compassionate environment. Let's begin by defining what agitation is and why it occurs. Agitation is a state of heightened restlessness, anxiety, or nervousness. It often involves physical manifestations such as pacing, fidgeting, or an inability to stay still, as well as emotional symptoms like irritability or frustration. In a medical or caregiving context, agitation can be a response to discomfort, confusion, or unmet needs. Assessment of disruptive behavior must include a careful description of the nature of the symptom, when it occurs, where it develops, and if any precipitants are identified. Agitation in nursing home residents can be caused by a variety of factors. Here are some common ones. Medical conditions. Chronic pain, infections, or other medical issues can cause discomfort and lead to agitation. Cognitive impairments. Conditions like dementia or Alzheimer's disease can cause confusion and frustration, leading to agitated behavior. Medication side effects. Some medications can have side effects that include agitation or restlessness. Environmental factors, noise, overcrowding, or changes in routine can be unsettling for residents. Emotional distress. Feelings of loneliness, depression, or anxiety can contribute to agitation. Communication difficulties. Difficulty in expressing needs or understanding others can lead to frustration and agitation. Personal care needs. Discomfort from unmet personal care needs such as hunger, thirst, or the need to use the bathroom can cause agitation. Assessment of disruptive behavior must include a careful description of the nature of the symptom, when it occurs, where it develops, and if any precipitants are identified. These factors may impact the resident in the following ways. Physical health. Chronic agitation can lead to physical exhaustion, increased risk of falls, and other health complications. Mental health. Persistent agitation can exacerbate feelings of anxiety, depression, and confusion, particularly in residents with cognitive impairments. Quality of life. Agitation can diminish a resident's overall quality of life, making it difficult for them to enjoy daily activities and social interactions. Social isolation. Agitated behavior may lead to social withdrawal or isolation, as residents might avoid interactions that they find stressful or overwhelming. Safety concerns. Agitated residents may engage in behaviors that pose safety risks to themselves and others, such as wandering or aggressive actions. These factors may impact the caregiver in the following ways. Emotional stress. Managing agitated residents can be emotionally taxing, leading to feelings of frustration, helplessness, and burnout among caregivers. Physical strain. Caregivers may experience physical strain from intervening in agitated behaviors, such as restraining or redirecting residents. Workload. Increased agitation can lead to a higher workload, as caregivers need to spend more time addressing the needs and behaviors of agitated residents. Job satisfaction. Persistent challenges with managing agitation can reduce job satisfaction and increase turnover rates among caregiving staff. Team dynamics. Agitation can affect the overall dynamics of the caregiving team, requiring more coordination and communication to manage challenging behaviors effectively. These strategies can help manage and reduce the residents' agitation. Create a calm environment, minimize noise and distractions. Soft lighting and a quiet atmosphere can help soothe residents. Establish routines. Consistent daily routines can provide a sense of security and predictability. Engage in activities. Offer activities that match the residents' interests and abilities. This can provide a sense of purpose and reduce boredom. Effective communication. Use clear, simple language and maintain eye contact. Be patient and give residents time to express themselves. Physical comfort. Ensure residents are comfortable by addressing pain, hunger, thirst, and the need for bathroom breaks promptly. Personalized care. Understand each resident's preferences and history to tailor care to their individual needs. Investigate their history to find out the who, what, when, where, and how of what triggers them, and then brainstorm with staff and family to find the root cause. Then management can be more targeted. Therapeutic interventions. Techniques such as music therapy, aromatherapy, or pet therapy can have calming effects. Monitor medications. Regularly review medications with healthcare providers to manage side effects that may cause agitation. Emotional support. Provide emotional support through regular social interactions and by addressing feelings of loneliness or anxiety. Here are some key methods of measuring the impact of agitation on care quality. Resident health and well-being metrics. Incidence of falls. Track the number of falls among residents, as agitation can increase the risk of falls. Use of restraints. Monitor the frequency of physical or chemical restraints used to manage agitation. Medication usage. Assess the use of antipsychotic or sedative medications prescribed to manage agitation. Quality of life assessments. Resident surveys. Use tools like the CHPS nursing home surveys to gather residents' perspectives on their quality of life and care. Family feedback. Collect feedback from family members regarding their observations of the residents' well-being and care quality. Behavioral and psychological measures. Agitation scales. Implement standardized scales such as the Cohen-Mansfield Agitation Inventory, CMAI, to quantify levels of agitation. Behavioral logs. Maintain detailed logs of agitated behaviors, noting frequency, duration, and triggers. Staff and caregiver metrics. Staff turnover rates. High turnover rates can indicate caregiver stress and burnout due to managing agitation. Training and competency. Evaluate the effectiveness of staff training programs on managing agitation and their impact on care quality. Clinical outcomes. Hospitalizations. Track the number of hospitalizations related to agitation or its complications. Infection rates. Monitor infection rates, as agitation can sometimes lead to behaviors that increase the risk of infections. Environmental and routine assessments. Environmental audits. Conduct regular audits to ensure the environment is conducive to reducing agitation, for example, noise levels, lighting. Routine consistency. Evaluate the consistency of daily routines, as disruptions can contribute to agitation. Key takeaways. It is important to assess both internal and external factors that can cause agitation. Agitation can affect the resident both mentally and physically, interfering with their quality of life. Listen to the resident's perspective of quality of life. Regular medication reviews can help identify side effects that could trigger agitation. Minimize disruptions in routines and maintain a calming environment. Ask for feedback on care quality from family members. These are our references. Thank you for listening to this presentation.